Major funding for KPBS Evening Edition has been made possible in part by Anderson Plumbing, Heating and Air, proud to support the mission of KPBS and privileged to serve San Diego clients. Anderson Plumbing, Heating and Air, helping homeowners maintain drain, heating, and cooling systems since 1978. And by the Conrad Prebys Foundation, Darlene Marco Shiley, and by the following. And by viewers like you. Thank you.
Good evening. It's Wednesday, February 10th. Thanks for joining us. I'm Maya Trabulsi. An emotional day on Capitol Hill as new video was shown in the impeachment trial of Donald Trump. The images, rioters storming the building, attacking officers, and lawmakers trying to escape the angry mob. Nadia Romero reports from Washington, D.C.
The Senate will convene as a court of impeachment.
The case against Donald Trump continues in the impeachment court of the Senate.
Donald Trump surrendered his role as commander-in-chief and became the inciter-in-chief of a dangerous insurrection.
House managers acting as prosecutors used then-President Trump's own words, both before the election.
We're in a fight for the survival of our nation.
And after.
We're going to fight like hell, I'll tell you right now.
Along with footage from the attack on the Capitol. As evidence, Trump committed an impeachable offense, inciting an insurrection.
He told them to fight like hell, and they brought us hell on that day.
He alone, our commander-in-chief, had the power to stop it. And he didn't.
Senators serving as jurors, forced to relive the siege when many hid in fear for their lives.
The harm was real. The damage was real.
Former President Trump's defense team will make their case later this week, but it's likely Trump will be acquitted, especially since only 6 Republicans voted to support the constitutionality of this case. Far short of the 17 GOP senators Democrats need to convict the former president.
I think that pretty well fixes in place what you might see as the eventual outcome.
In Washington, Nadia Romero, KPBS News.
We are carrying PBS NewsHour's coverage of the Senate impeachment trial in its entirety on KPBS 2. You can also listen on KPBS Radio, or you can live stream at kpbs.org. Another vaccination superstation is on its way to San Diego County. That news comes on the same day that new numbers on COVID in California show the state is making significant progress in slowing the spread of the virus. Here's KPBS reporter John Carroll.
At a place known for horse racing and the annual San Diego County Fair, something new. On Friday, the Del Mar Fairgrounds will become a life-saving place when it becomes the county's latest vaccination superstation.
We really do believe it's important for our community to get vaccinated. The light at the end of the tunnel are the vaccines.
In the same vein as the UC San Diego Health County partnership at Petco, Scripps Health is now partnering with the county and the Del Mar Fairgrounds to open this vaccination superstation. As long as you fall into the tiers, healthcare workers and those 65 and older, you can get vaccinated.
It doesn't matter, frankly, whether or not you have insurance or not, or where you live within the county.
I just wanted to quickly update you on where we are in this pandemic.
Governor Newsom gave his update from the Fresno County Fairgrounds, which became a vaccination superstation last month. Newsom had good news when it comes to COVID in California.
A month ago today, we had 13.9% positivity rate here in the state of California. Today, we're down to 4.8%.
Newsom says 1 month ago, we reported nearly 50,000 cases on one day across the state. Today, that number stands at 8,400. The governor says we could be doing a lot more if not for one major problem.
We simply do not have the allocation that we need to get to the levels where we all need to go.
The statewide vaccine shortage reflected in San Diego County.
Unfortunately, we still don't have adequate doses from the federal and state government.
Newsom says the federal government is ramping up vaccine distribution, so more doses should be heading California's way in the coming weeks. The governor was heckled by protesters throughout the news conference who want him recalled. John Carroll, KPBS News.
And we just got new coronavirus numbers from the county. Sadly, another 51 deaths were reported and 810 new cases. Nearly a year into the pandemic, most California schools are only open virtually. KPBS reporter Matt Hoffman has more on the efforts locally and statewide to get kids back in the classroom.
Our schools in Escondido give us a poignant example of what happens when educators teach in person without being vaccinated. Just 2 days after we returned to in-person instruction last week, we have roughly 100 people quarantined, with classes opening just to close right back down.
This afternoon, some San Diego parents, teachers, and administrators advocated for school staff vaccinations, saying they are critical to support safe and stable in-person learning, a message that officials seem to be hearing.
To get our kids back in school, a top priority for all of us, particularly parents.
Governor Newsom says a $6 billion plan to reopen some schools could arrive in the state legislature by Friday.
That will allow our youngest cohorts to return safely to school, starting with kindergarten to second grade, and ultimately get cohorts up to sixth grade, at least in that first phase.
Just last night, the Oceanside Unified School District voted to return some in-person instruction for all kindergarten through fifth grade students in mid-March. Officials say parents can expect letters from elementary school principals later this week with more information.
School is such a huge part of children's lives, not just their educational part, but it's the social. For a lot of children, it's where they get fed, it's where they get their mental health support.
This week, 5,000 California pediatricians called for the urgent reopening of schools with proper safety protocols.
Like wearing a mask, distancing, not being unmasked in close contact for long periods of time. And we know that that requires a lot of coordination from public health and from teachers and school staff. But we're confident that that can happen.
Even though a deal to reopen schools is close, teachers and their unions still have some questions.
What I'm hearing from members is that they really do not feel comfortable coming into classrooms while we're still in the purple level.
San Diego's state-adjusted case rate is still 5 times higher than it needs to be to enter the less restrictive red reopening tier. If and when that happens, more schools could decide to open. Newsom says he wants teachers to be prioritized for vaccinations, but there's a supply shortage.
So even if it is made available to teachers, the big question is, how accessible are those vaccines? How accessible will appointments be? And it's not just our school district. There's 12,000 employees in San Diego Unified, but there are 42 other districts in our county. So
teachers have also called for regular testing and hope a deal that prioritizes the safety of teachers and students is in place soon.
Teachers are ready to go back, and we definitely want to see schools back in session, back in person in the fall. We don't want to see another school year like this.
Matt Hoffman, KPBS News.
About 12,000 daily COVID-19 vaccine doses went into the arms of San Diegans the first week of this month. That includes doses administered by the military. That excludes, doses administered by the military, the VA, and tribal agencies. But KPBS health reporter Taryn Mento tells us that's still below what is needed to vaccinate 70% of our population by July.
There needs to be 22,881 daily doses administered in the region to reach that 70% goal. That's not including what may be administered by the military, VA, or tribal health programs, which don't report directly to county health officials. Excluding those agencies, the county and other vaccinators have the capacity to administer 21,000 doses a day. But supply issues from the state are keeping the region below that. County Health and Human Services Agency Director Nick Mascione delivered a presentation to the Board of Supervisors on Tuesday.
Last week, to give you a sense, we received just over a quarter of the doses we requested for the state for our entire region.
Mascione says the county is working to further expand the region's vaccination capacity to 35,000 doses a day by the end of this month. In the meantime, there are still 140,000 doses in the county waiting to be administered. Mascione says the county is working with the region's more than 250 vaccine providers to ensure they use up doses within a week of receiving them. He says in some circumstances, the county has reallocated some of those doses. Taryn Mento, KPBS News.
A new seniors-only vaccination site is opening tomorrow in San Marcos. The first of its kind site will administer Moderna vaccines specifically to those 65 and older. It will focus on the most vulnerable who do not have the support of family members or caregivers. Organizers studied other vaccination sites across the county to streamline the process for seniors.
See at this site is a very limited movement for the senior. So we check in here where we'll have pre-populated the registration forms for the senior. They'll then be escorted by a team to our vaccination cells. And once they're in these seats, and we have seats to accommodate for caregivers as well, they don't need to move. So everything else will come to them.
The San Marcos Clinic will be open Monday through Friday with the capacity to serve 500 or more people per day. Appointments can be made through the county website or by calling 211. San Diego County leaders say their vaccination plan is based on a policy of social equity. As KPBS reporter Max Rivlin-Nadler tells us, one neighborhood filled with immigrants hit hard by the pandemic still has limited vaccination sites.
As vaccination superstations have opened downtown, in the South Bay and North County, City Heights and the rest of the Mid-City area remain without a major vaccination hub, instead relying on local providers to reach out to eligible residents. That's leaving people behind, says longtime City Heights resident Anna Daniels, who says it was her own privilege that made it possible for her to be vaccinated.
I'm a upper middle class white person with a car. I got my vaccine, Max. That should be no surprise. I am the low-hanging fruit, the people that always manage to get it first.
She's worried that the complicated process to sign up for a vaccine and the need to rely on a car or rideshare puts up roadblocks for many people. Right now, La Maestra Health Center in the heart of City Heights is focusing on vaccinating its own patients. But Chief Medical Officer Javier Rodriguez says that if you're eligible for the vaccine, meaning you're 65 and older or a healthcare worker, it's easy to become a patient at La Maestra and receive one by going to its screening station on Fairmont Avenue. La Maestra has already vaccinated 1,000 people and has also been reaching out to community members to let them know about the vaccine.
As you know, there is a lot of vaccine hesitancy, vaccine resistance. So I think, providing a lot of education, whether it be by either in those phone calls, in the texts that we send, flyers that we've come up with, showing them that they are safe and effective, the vaccines.
Rodriguez also says that the health center is ready to send out its mobile units with the necessary cooling equipment to communities once the state gives the okay. City Heights City Council member Sean Elo Rivera says that the city of San Diego should be opening up more vaccine opportunities in City Heights in the coming weeks, and will lean heavily on community organizations like La Maestra to get the word out about opportunities, and overcome years of distrust between the medical establishment and the Black, Latino, immigrant, and indigenous communities.
But we have to accept and acknowledge the damage that has been done by the misconduct of government over generations, and as well as the trauma that folks carry with them from their experiences wherever they may have come from. We can't do this effectively without acknowledging that. And once we've made that acknowledgement, then we can actually have a real conversation about what it means to develop and build trust.
But he also stressed that decisions on where to place the first mass vaccination sites were based on where the most cases were being reported, like the South Bay. On Wednesday, the county told KPBS that more vaccine opportunities for City Heights were on the way, but couldn't attach a date, based on still limited vaccine supplies. Max Rivlin-Nadler, KPBS News.
The Navy's top commanding officer is condemning racist incidents aboard two San Diego-based ships. Last month, a black sailor on the USS Lake Champlain found a noose above his bunk. And in just the past week, hateful graffiti was discovered in a bathroom aboard the USS Carl Vinson. The U.S. Secretary of Defense has ordered a military-wide stand down on April 6th for commanders to address the issue of extremism within their troops. Scientific detective work, some of it done in San Diego, helped find and stop companies illegally making an outlawed ozone-depleting chemical. Scripps Institution of Oceanography researcher Ray Weiss says researchers were able to track a specific chemical to Chinese factories. He says about 24 monitoring stations made that possible.
It shows you that
that by measuring what actually goes into the air and making that information widely known, that problems can be solved.
2 studies tracking the banned chemical levels in the air are published in the current edition of the journal Nature.
Temperatures will be on the rise on Thursday. Should be a warmer day, but it starts to turn cooler again for the end of the week. We're keeping an eye on 2 fast-moving systems. They're diving in from the northwest. Limited moisture with these systems, so we'll find cooler conditions, gusty winds, and some light showers. Let's take a look at our conditions for tonight. Pretty quiet. Temperatures cooling down to low 40s in Escondido, mid-40s in El Cajon. Borrego Springs at 51 and Mount Laguna is at 41. San Diego, the low tonight in the low 50s. Now on Thursday, here comes our first system. That will bring rain down to about the Bay Area. We'll be on the dry side and our temperatures will start to rise up. So a little bit warmer with the less of that marine layer. Clouds and sunshine, Oceanside to San Diego, highs around 64, near 70 in Ramona and 72 El Cajon, so some above average temperatures. 81 in Borrego Springs and 66 in Campo. Looks like a great day. Friday, though, that system dives rapidly southeastward with limited moisture. So we'll see some strong gusty winds, and it will turn cooler here. Here's the way it looks in the upper air chart. Here's that system that will swing rapidly in from the northwest on Friday, and then another system dives down from the northwest from Saturday into Sunday, but the trajectory is not favorable for a lot of precipitation here. So we'll look at some clouds and a passing shower Friday from the first system. Second one, well, we don't see much happening here at the coast. Let's head into the inland areas. You can see a nice day Thursday. Showers with our first system. Second system moving through later Saturday into Sunday. And then as we head our way to the mountains, well, that next system is showing up with those strong winds, and you can see some showers around as well. And into the deserts, well, not a lot of precipitation. Nice and warm Thursday, and the temperatures will be hovering in the mid-upper 70s over the weekend. And for KPBS News, I'm meteorologist Mark Mancuso.
After months of calls for updating mask guidance, the CDC is officially endorsing doubling up your face masks.
We continue to recommend that masks should have 2 or more layers, completely cover your nose and mouth, and fit snugly against your nose and the sides of your face.
And the CDC is also updating the kinds of masks you should wear, saying that a good fit and wearing it correctly are most important. It comes the same day as a study showing wearing both a disposable mask and a cloth mask is more than 92% effective in improving protection. So far, the COVID-19 vaccine appears to be safe for pregnant women, but the National Institutes of Health wants more pregnant and breastfeeding women involved in trials. About 20,000 moms-to-be have already been given the shot. None were involved in Pfizer or Moderna's clinical trials. But as KPBS reporter Claire Tregeser tells us, some doctors now say this was a mistake and are turning their attention to studying breast milk from women who got the shots.
I panicked. I was like, what have I done? Oh my God, this is a total mistake.
Jennifer Elwell, a nurse at UC San Diego, recalls a scary moment after breastfeeding her 8-month-old son. She had just received her first dose of the COVID-19 vaccine and knew the science behind her decision.
It just seemed like an easy way to help my baby. But yeah, I think initially right afterwards, even before people said anything, I got home, fed the baby, and then I looked at my husband and I was like, should I not have done that?
Doctors and medical experts recommend women who receive the vaccines continue breastfeeding. In fact, the conventional wisdom is that women who get the vaccine likely pass on protective antibodies to the baby through their milk. But Elwell's uncertainty is understandable, given the fact that no clinical trials of COVID-19 vaccines were done on pregnant or breastfeeding women.
Hindsight's 2020, although we shouldn't use 2020 anymore as an example because that was a horrible year, clearly.
Dr. Lars Borda runs the UC San Diego Mother Milk Infant Center of Research Excellence, which is now studying the impact of the vaccine on breast milk.
The notion was originally to protect women from research when they're in this vulnerable space of either being pregnant or breastfeeding, so that we don't try out any drugs in that space. But really what we should do is we should protect women and their babies by including them in the research to then have data whether it's safe or not.
For the past 6 years, UC San Diego has run a collection center for breast milk called Mommy's Milk that studies the effects of all kinds of things on mother's milk. Dr. Christina Chambers is the founder and director.
Can the mother, in addition to protecting herself with the vaccine, produce antibodies to the virus that will actually benefit her child as well? So we'll be looking over the course of the vaccine course, and then after that, when those antibodies appear and at what level. And then we'll also look at other things about the milk. Does it, the fat, protein, carbohydrate composition change at all? Is there any difference in milk supply? So are there any indications that the baby has any unusual signs or symptoms?
So far, 1,200 women from across the country who've received a vaccine are shipping Mommy's Milk bags of pumped breast milk, 1 from before the vaccine and 7 more over 2 months after getting the first dose. Answers to questions about the vaccine's impact on the health of babies will take the most time, but the researchers are cautiously optimistic they will find antibodies. They also expect to find that the vaccines do not put anything in breast milk that is harmful to babies. All of these theories are compelling to Dr. Christina Pade, an ER doctor at Rady Children's Hospital and mother of a 6-month-old. She took the vaccine, continues to breastfeed, and is one of the study's participants. As any breastfeeding mother knows, it can feel painful to give up any pumped milk, but Pade says it was worth it in this case.
We really are only asking for 1 to 2 ounces with each sample, so I think it ended up being like 15 to 20 ounces, which in the end is not not even a day's worth of feed, and so I felt like it was worth it for science.
That science is what other moms like Carly Keats are waiting for. She is breastfeeding her son and is generally very pro-vaccine, but says it's hard to make a decision without data.
There really isn't actual data yet saying that it doesn't, pass through. And if it does, maybe that's a good thing, maybe it's a bad thing, but there really isn't anything statistically or data-driven that's telling me, yes, it's 100% going to be good for you and for your baby.
Keats may have an answer by the time it's her turn for a vaccine, as results from the first 500 women from the UC San Diego study are expected in a few months. Claire Tregister, KPBS News.
As the number of Americans getting vaccinated continues to rise, so do concerns over the highly contagious virus variants. It's led some to suggest the need for a yearly COVID shot, much like the flu vaccine. Mandy Gaither has more.
Across the U.S., the race against coronavirus variants continues. About 1 in 10 Americans have now received at least 1 dose of the vaccine.
I already had COVID, and so I'm a little bit nervous because of the reinfection rate. That's the big thing right now. I wasn't as nervous. I was going to wait it out and wait till later on when it's not so urgent, but I thought I better get in on it now because of the reinfection.
Only one state now, Alaska, is showing an upward trend in coronavirus cases, but new CDC data shows nearly 950 known cases of the highly contagious virus variants in the U.S. CEO of vaccine maker Johnson & Johnson now suggesting those mutations may mean an annual COVID shot will be needed for years to come. The company asked the FDA for an emergency use authorization of its vaccine last week, and a green light could further boost vaccination doses available across the U.S.
Supply will increase, and we have to make sure that American public sees the data and has reliable sources to go to so they increase their comfort in being able to take the vaccine.
A new Gallup poll of more than 4,000 Americans taken at the end of January shows 71% of those surveyed are now willing to get COVID-19 vaccines, but 2/3 were not satisfied with how vaccination is going in the U.S. For Health Minute, I'm Mandy Gaither.
And we have more information at kpbs.org. Just click on the Vaccines tab on our homepage, and you'll find a searchable map with clinic locations and links to make an appointment if you're eligible. Those 65 and over can also call 211. Former President Donald Trump will not be back on Twitter even if he wins elected office again. And that's the word today from a Twitter executive who says the ban is permanent. Twitter kicked Trump off its platform last month after the U.S. Capitol riots, quote, due to the risk of further incitement of violence. Twitter had already temporarily locked Trump's account.
I'm Judy Woodruff. Tonight on the NewsHour, Democrats make their case to convict former President Trump for incitement of the Capitol insurrection. Coming up at 7 after Evening Edition on KPBS.
A unique birthday celebration at Birch Aquarium for two weedy sea dragons. The babies were less than 1 inch when they were hatched 1 year ago, and now they're nearly 9 inches long and finally big enough to be added in with the other sea dragons in the main habitat. The aquarium is closed for now, but you can check in on these unique animals on a new live 24/7 Sea Dragon cam. And you can find tonight's stories on our website, kpbs.org. Thanks for joining us. I'm Maya Trabulsi. Have a great evening.
Major funding for KPBS Evening Edition has been made possible in part by Anderson Plumbing, Heating and Air, proud to support the mission of KPBS and privileged to serve San Diego clients. Anderson Plumbing, Heating and Air, helping homeowners maintain drain, heating, and cooling systems since 1978. And by the Conrad Prebys Foundation, Darlene Marcos Shiley, and by the following. And by viewers like you. Thank you.